I had a stepmother who had a terminal diagnosis when she was 33, and I was only 14.
My journey began with SouthernCare Hospice as a volunteer, where my mother-in-law was actually the volunteer coordinator, and I would spend my summers volunteering.
When I first was touched with hospice, I was working in an assisted living for Alzheimer's and dementia patients. And I had a patient that was referred into my building. I went to his home and did an assessment and found that he was in dire straits. His family had little contact with him, and his house was full of animals.
It was ironic to me to know a woman that was devoted to her job as a hospice volunteer coordinator to end up being on the other end of the spectrum as a patient on hospice.
I saw hospice come in and take care of her. They took time to sit and talk to her about anything and everything.
I got to see firsthand how hospice really works, where they can come into the home and resume care, allowing you to spend more quality time with that family member instead of in a hospital room or a nursing home, that they're able to stay at home and be as comfortable as possible.
So I actually adopted one of the dogs and brought him home. He's fabulous. He's living very healthy. But that patient came back to my facility and lived with me for a period of time and then opted hospice services. And SouthernCare came in and provided the most awesome service ever for that patient. His family was able to come in and actually live in our facility for a couple days with the hospice agency, and he died with great dignity and wonderful quality of life. Hospice care is a service that we are allowed to provide through the Medicare hospice benefit, which is Part A, which is the hospital part of Medicare. Services that we're able to provide to families to make sure that patients who have been certified with terminally ill diagnoses are able to receive end-of-life care. Kind of the goal of hospice is to make sure that patients die with dignity, that they are never by themselves at the end of life, and to provide their families with compassion and comfort during that very difficult time of their life.
SouthernCare will not turn away a referral or a patient regarding their insurance, whether it's Medicare, Medicaid, private insurance, or even charity. Everybody has the right to be evaluated for hospice.
In the past and even today, hospice was targeted toward patients with cancer. We've extended our level of care to those who have non-cancer diagnoses. For instance, kidney disease, cardiac problems, Alzheimer's, dementia.
The type of care that we provide as a hospice agency is considered non-curative. We want to make sure that any patient that is looking to utilize hospice services is no longer seeking aggressive treatment. We want to make sure that they're ready to learn about their disease process and to receive the comfort and care and compassion that our nurses can provide to them.
Some hospice patients don't have the luxury of having family in town with them. So what SouthernCare does is whatever it takes, whether it be giving that patient a manicure, brushing their hair, having that social interaction of just talking with them, maybe reading to them, that's where we go the extra mile.
Some of the things that make SouthernCare different from other hospice agencies are our quick referral time. We want to make sure we get to those patients as quickly as possible and to their families. We really believe that our nurses are experts in the field of hospice, which makes a huge difference when it comes to comfort for our patients. Some of the other things that make us different are our education. SouthernCare provides a phenomenal amount of education, not just to our families and our patients, but also our referral sources and our physicians that come in contact with our patients.
The people that work at SouthernCare all have a heart for hospice. They've either had a personal encounter or because of their experience in their position, they are easy to empathize with the patients. That's what sets us apart.
I believe in SouthernCare and I support their services because I know the type of quality care that we provide. SouthernCare has an awesome mission statement and an awesome philosophy, and our staff truly believe in the cause that we service.